I'm David Ruiz, and I'm a BOC certified athletic trainer. Today we're going to talk about one of the most underutilized rehab tools, and that's a furniture slider. You may have seen my other video about hip hinges with a furniture slider, and today we're going to work on a variation. You can see Jess is in a boot to simulate one of your patients who may have a lower extremity issue. If someone can bear weight in the boot without a crutch, you can certainly do this exercise. As athletic trainers, I think we often forget that we should be doing a lot of weight-bearing stuff and that it's safe to do this. She's in the boot, and if she's walking around campus in this boot without a crutch, she can certainly be doing this in your athletic training facility. She's in the boot, she's protected. So show us the hip hinge with the furniture slider. Now at first this will be an awkward movement, but once they get the motion, they can really work this. And then go to the other side. This is a great way to train balance and proprioception and strength on the injured side. Great. We can also do this if we can't be in full weight bearing, we can do a regression which goes into a plank position. So go ahead and down into your plank position. And now show us hip flexion with the boot. So there's no reason to not train hip flexion, knee flexion in this plank position just because someone's in a boot. Great, go ahead and stand up. Now, remember, we're not always going to have our patient in the boot during the rehab process, so let's move on without the boot. So let's go back into this plank position. Go ahead and put that under your foot. So there's a lot we can learn from this exercise. First thing is how much available hip flexion does she have? So go ahead and do 3 reps for us. And then switch sides. Great. And then we can look for any asymmetry there. And bring that back to that right foot again. Let's remember our DNS principles of base of support. So what we want to do is we want to adjust her hands, so go ahead and come down to your knees. We want to make sure that she's applying force throughout her hand in that diagonal motion, PC form, and base of the second on both. A little bit of bend in the elbow, nice centration of the shoulder joint. So go ahead and come up into your plank position. So we want that base of support. We want to look for any open scissors. We can see she's got a little dropping in her spine. So bring your spine up, nice. Activate here, good. Breathe wide. Good, stabilization function of the diaphragm. Good, maintain that, yes, very nice. Go ahead and do a couple reps. Sometimes what we'll see with people is that as they do this, stay on the right foot for me. You might see some deviation as they flex that knee. That knee might go in towards midline. It may come out to the side. And so this really allows us to help correct that. We need to find out why that is. Do they have some kind of joint restriction there? Does their hip pinch? Or is it just a motor control issue? Sometimes they just need to be coached. So when you do this, I'd like your knee to go straight towards your shoulder. Perfect. We also want to make sure that we've got balanced hip activity. So a way we can do that is to give them a little bit of pressure on the knee. So give me resistance against my hand. Good, and maintain that resistance as you bring your knee up. Yes. So that's the abduction action of the glute. So that'll help activate that. Go ahead and come down for a second. As you can see, this exercise starts to get challenging because you are maintaining that plank position. Okay, come on back up. You can give them that pressure there. You can come in with your hand and internally rotate their femur a little bit. Don't let your hips drop. And resist this rotation, yes. And remember, the glutes are external rotators. So we're firing the glutes both concentrically and eccentrically through this motion. This is not just a hip flexor or quad exercise. We want balanced activity. We want to fire those glutes. Now, oftentimes people, either their wrists get a little sore or we can't put them on their wrist. So what we can do is we can bring them down to their elbows, and you'll see with this modification, she's not going to be able to get her knee very far up. So come on up, come on down. So what we can do is we can bring her up a little bit. Great, so on your elbows, bring your elbows forward a little bit. Good. Hands flat, elbows wider than your hands. Yes. And now bring your knee up. Going all the way and touch the box. That's it. And as you can see, she's deviating in a little bit. So yes. And I told her, or I said that, and she just corrected it. Let's make sure we're always focusing on our DNS principles. We can load on the inside of the elbow. Make sure there's nice joint centration of the shoulder, paying attention to the scapula, elongation of the spine at both the head and the sacrum. Avoid open scissors, so bring the spine up. Yes. Activate here. Very nice. And activate here. Yes. Good. Go and stand up. Now another option is maybe you can load their wrists or hands, but they're just sore in that hyperextension motion. So we can give them these push-up handles. Great. And they can adjust their wrists to a more comfortable position and now do the exercise. And now you're in more of a mid-range position of the wrist. And if they're super tough, a martial artist or a boxer or just street fighter, you can take away the handles. So take the handles away. And you can go down on your fists. Great. And 1 or 2 reps there. And again, always paying attention to our DNS principles. Elongation of the spine, centration of the shoulder joints, a little bit of bend in your elbow. Breathe wide. Yes, bring your spine up here. That's it. Activate here. You can see she's getting tired. Go ahead and come on down. So with a very simple exercise and a very technologically unadvanced tool, you can do a lot. You can train the whole body with the plank. You can use all of your DNS principles, elongating the spine, joint centration through the shoulder, the wrists, the elbows, the relationship between the ribs and the pelvis. We can look at any asymmetries in hip flexion and hip extension. We can activate the glutes and really wear them out a little bit very quickly. So if you'd like to learn more about this and DNS principles, go ahead and go to www.dnsflorida.com.